Leukemia in a 13 years old in Ecuador. Definitions. Leukemia is actually a group of different cancers of the blood cells. Leukemias can be acute or chronic, and people with chronic leukemias may not notice any symptoms before the condition is diagnosed with a blood test. Acute leukemias are more likely to cause symptoms. Symptoms. Symptoms of leukemia include fevers, night sweats, and swollen lymph nodes that are typically not painful or tender. Fatigue, weight loss, and bone or joint pain are other potential symptoms. Easy bruising and bleeding tendencies may result in bleeding from the gums, purplish patches of skin, or small red spots under the skin.
I was born at my house into a loving family. They do their best. They probably weren't doing all that much until I came along.
Ava's first bath.
I really love art.
Thinking of you, thinking of nothing.
Pretty much anything I found in nature became a craft project. Most of all, I love to color.
You're not so far away, but
I stopped coloring one day.
near.
That was how we figured out something was not right with my body.
When the day
The doctor said I was very sick. I had to be at Children's Hospital for a couple of weeks.
I love you so.
I got a lot of pokes. The hospital became a second home.
I love you so.
Also, my mom was 7 months pregnant with my baby sister. A lot was happening. I got really sick. I got so weak I could hardly walk. And I lost my hair. I was kind of looking like a freak. Dad gave me a David Beckham faux hawk. That lasted for like 5 minutes, 'cause I'm a girl. All of it was a big challenge, but not unfamiliar because leukemia had already visited our house. Earlier that same year, my dad was diagnosed with a different kind of leukemia. I saw my dad get sick and get better again, so that was good to see. And going through treatment together was a big help. His kind of leukemia is controlled with a special medicine he takes every day, but mine, after over 2 years of treatment, is cured. That's right, you heard me, cured. Because of people like you, my leukemia is gone. Because of generous people like you, my dad is alive today. I thank you for being a part of the cure. When you give money, when you tell your friends, when you do research, you are the answer for curing cancer.
Application in medicine. A 13-year-old Maria Alciste clings to life and stands up to the leukemia that was diagnosed 5 years ago. Like her, 50 children between inpatients and outpatients receiving treatment for various cancer in Solca of Loja. She arrived to the hospital at 6 a.m. with severe fever and bone pain. After being diagnosed with leukemia, she started her treatment.
In general, symptoms of leukemia are ones that have to do with not having enough normal blood cells. And if you don't have enough normal white cells, you may present to your doctor with infections, for example. So chronic, unexplained, serious infections, fevers, chills. Then also, because of the platelets can be affected, a lot of times patients will present with bleeding or easy bruising. We sometimes see what we call petechiae, which is just a medical word for a small red dot under the skin. And we frequently will see that, at least initially, in the lower part of your body, say below your knees, ankles, and feet. As the disease gets worse, you may see those dots elsewhere, but those petechiae, again, small red dot under the skin, that is a symptom or sign of having low platelets, which can be a symptom of leukemia. And then anemia, feeling bad, malaise, not sleeping well, sleeping too much. I mean, those are some of the things that we see with leukemia. Those are the acute leukemias. In the chronic leukemias, sometimes they're found in a routine blood test. So some chronic leukemias don't have a lot of symptoms initially. Patients with chronic leukemia may be discovered in the emergency room when they're there for another problem. Or they may be discovered after a motor vehicle accident where you look and you see, hey, you've got too many white blood cells. Sometimes people will just go to their primary care doctor and over a period of time, they will say, you know, Mrs. Jones, last year your white blood cell count was a little on the high side. Now it's a little higher. We need to look into it. Where they really don't have a lot of symptoms. And one of the scary things about this disease is how quickly it can come on you. And that's a hallmark of the acute form of leukemia. You can be very well, maybe a little fatigued, but for the most part feeling yourself. And then 3 weeks later, you can have difficulty with bleeding gums. You know, you bump yourself on the kitchen counter and you get a huge bruise instead of a little one. You have these petechiae, these red dots on your legs, you know, maybe blood in your urine. And all of that comes on real quick. And it's just because of the rather rapid way that acute leukemia can compromise your production of normal blood cells.
Pros and cons. Pros. Although her treatment is really expensive, she has her chemotherapy every week and she is getting better. Cons. Leukemia should be treated for free. However, Solca doesn't come with enough money, so Maria Alcisne's treatment is really expensive. Also, there is a lack of doctors and of medicines.
According to the World Health Organization, cancer cases are expected to rise a whopping 57% worldwide in the next 20 years. You probably know or are related to someone who has fought cancer, and you may have seen them go through chemotherapy. But what is it? Hey guys, Julia here for D News. Currently, a diagnosis of cancer leaves patients with three main options for treatment: surgery, radiation, and/or chemotherapy. Of the three, chemotherapy can be the most debilitating. It's a pretty barbaric treatment. Technically, chemotherapy is a poison, but it's a poison that ultimately saves lives. The original chemotherapy drug was a derivative of mustard gas. During World War II, scientists noticed poison gas exposure shrunk the lymph nodes and along with it shrunk lymphoma, a malignant tumorous growth of the lymph nodes. Even though it's a poison, it proved extremely successful in treating cancers throughout the mid-20th century. Today, chemotherapy is used to dramatically improve survival rates for breast cancer, and it's the primary form of treatment for cancers of the blood and has great success in the early stages of Hodgkin's lymphoma. It's often used before or after other treatments for other types of cancers. For example, when cancerous cells are left behind after surgery or radiation, adjuvant chemotherapy is used, whereas neoadjuvant chemotherapy is used to shrink a tumor before a surgery. Chemotherapy works by targeting cells that divide rapidly, one of the hallmarks of malignant tumors and other cancers. Like the chemotherapy drug etoposide is used frequently to treat diseases like lung cancer, Ewing sarcoma, and lymphoma. According to a study published in the journal Chemistry and Biology, the drug attacks the topoisomerase II enzyme, which cancer and other rapidly dividing cells depend on to unwind DNA. By inhibiting this enzyme, the cell can't make DNA as well, and thus the cell gets programmed for death, which in medical speak is called apoptosis. But unfortunately, these kind of drugs don't target just cancer cells. They affect other rapidly dividing cells in the body as well, like hair follicles, which is why chemo patients often lose their hair. Other common side effects I'm sure you've heard of include nausea and fatigue. As common as nausea is, it affects people differently, perhaps because of their expectations. A study published in the journal Cancer found that patients who think nausea is a very likely side effect experience it 5 times more often than those who think it's less likely. According to the National Cancer Institute, up to 96% of chemotherapy patients experience fatigue. People describe it as feeling jet-lagged all the time. Chemotherapy makes people tired because it changes the endocrine system, circadian rhythms, metabolism, and serotonin production. There is some evidence, though, that antidepressants and weirdly exercise helps fight fatigue. Chemotherapy can also cause diarrhea, hearing loss, and even decrease sex drive. But will we one day treat cancer without it? Well, new treatments are starting to pave the way. One study published in the New England Journal of Medicine found that molecularly targeted drugs work almost as well as chemotherapy without many of the negative side effects. Rather than suppressing all fast-growing cells, targeted therapy works by honing in on specific mechanism cancer cells use to grow. Basically, it's like hitting the bullseye rather than spraying the wall full of bullets. As Dr. George Dimitri at the Dana-Farber Cancer Institute told Time, the future lies with personalized medicine, where therapies are targeted towards an individual's cancer. When planning a strategy to fight against a cancerous tumor, it's helpful to know what a tumor is. I explain more in this episode right here. Many tumors come from an
Issue in Ecuador. 20,000 new cases of cancer are recorded each year. 3 of every 100 cases are children. Leukemia represents 40% of deaths in Ecuador.
In 1845, a Scottish physician named John Bennet carried out an autopsy on a 28-year-old man who had died suddenly. He noticed that the man's spleen and liver were greatly enlarged, while his veins were clogged with white infection-fighting cells. In previous cases like this, doctors had taken this pus-like substance as a sign of infection. But Bennet diagnosed a disorder of the blood itself, a malfunction from within the body rather than an attack from without. Just 5 weeks later, a doctor in Germany named Rudolf Virchow published a similar case report. Virchow described an imbalance in his patient's blood. Healthy blood is composed of mostly red blood cells and plasma, with just 1% white blood cells. But the majority of this patient's blood was white. Virchow called the disease leukemia, from the Greek word leukos, or white, and haima, or blood. About 350,000 people worldwide are diagnosed with leukemia, or cancer of the blood, each year. Cancer occurs when genetic mutations cause abnormal cells to divide and multiply in an uncontrolled way. But unlike most cancers, leukemic cells don't belong to an organ, like the lungs or stomach, and don't result in the growth of a tumour. Instead, the uncontrolled cell growth takes place in the bone marrow. The marrow is the body's blood factory, where a single type of multipotent stem cell divides and matures to give rise to 12 different kinds of blood cell. Leukemia can occur at different stages of this process and in virtually every type of blood cell. In all cases, the abnormal cells build up and fill the bone marrow, ultimately preventing other cells from developing. The cancerous cells can also spread to other organs in the body. The rate at which leukemia progresses and the course of treatment differ depending on the type of cells affected. When a normal stem cell divides, it produces one of 2 slightly more specific cells, called myeloid and lymphoid stem cells. These give rise to several other cell types. Each myeloid cell eventually becomes a red blood cell, a platelet, or an infection-fighting macrophage. When cancer occurs in these cells, it's known as myeloid leukemia. Lymphoid cells develop into T, B and natural killer cells. Cancer occurring in these cells is called lymphoid leukemia. When cancerous mutations show up in a myeloid or lymphoid cell that is still developing, abnormal cells quickly fill the marrow and interfere with normal function. This form of the disease is known as acute leukemia because it progresses so rapidly. As cancerous cells proliferate, the rate of normal blood cell production plunges. Chronic forms of leukemia occur in more mature lymphoid or myeloid cells. The irregular cells build up in the bone marrow over a period of years, interrupting the production of normal blood cells and spreading to other parts of the body. These categories, acute and chronic, lymphoid and myeloid, are used to assign cases of leukemia to one of 4 subtypes: acute lymphoid leukemia, chronic lymphoid leukemia, acute myeloid leukemia, and chronic myeloid leukemia. Acute lymphoid leukemia, or ALL, primarily occurs in young children between the ages of 1 and 4. The other 3 types most often strike later in life, particularly after the age of 70. When Rudolf Virchow gave leukemia its name, no successful therapies existed, and the disease was nearly always fatal. But prognosis has vastly improved since then, thanks to the development of chemotherapy and other treatments such as bone marrow transplants. Within the past few decades, a person's chance of surviving for 5 years after diagnosis has risen by an average of about 20%. For people with chronic myeloid leukemia, CML, survival rates have climbed even more, by about 30%, thanks to the development of the first targeted cancer therapy. Now researchers are working to understand the genetic underpinnings of other forms of leukemia and to decipher the molecular secrets of leukemic stem cells. Lessons learned from these and other research efforts hold promise for the development of new, more effective weapons for combating leukemia, and may also provide key insights in the broader war against cancer in all its forms.
Conclusions. Maria Encinas is still getting her treatment every day and is slowly getting better. Chemotherapy is getting more expensive in Ecuador each day.
Leukemia is a type of cancer. It is cancer of the blood cells in the bone marrow. But how does it all happen? What happens to the body when it has leukemia? To find out, we must travel into the body itself, entering the micro-world of the cells. The body performs thousands of different processes. These processes are carried out and controlled by workers called cells. One of the most important cell groups are the blood cells. These blood cells are made in the bone marrow, which is where our journey begins. The body needs to make billions of blood cells a day. Because of this, the bone marrow has to operate quickly and efficiently. It makes white blood cells, the body's doctors, red blood cells, the oxygen carriers, and platelets, which are like internal plasters. All the different blood cells are grown from stem cells. The cells then mature in the marrow and are released into the bloodstream to take their part in the running of the body. Sometimes a defective blood cell is created. The cell cannot perform its vital role efficiently. Usually a sign would tell the cell to destroy itself. However, this cell ignores the body's instructions and begins a process called mitosis. It divides itself into 2, making an exact copy. Each new cell does the same, rapidly reproducing the same defective cell. These defective cells are called cancer cells. The bone marrow becomes filled with the cancerous cells. It thinks that it has created enough blood cells and the production of new blood cells is halted. The cancerous cells enter into the bloodstream and spread through the body. If a virus or harmful bacteria enters the body, the white blood cells are sent to fight the foreign cells before they can reproduce. But the cancerous white blood cells are immature and do not have the correct information on how to combat these infections. The foreign cells divide and spread throughout the body, making the body sick. Cancer can be treated with chemotherapy. This is when a medicine called the antineoplastic drug is introduced into the bloodstream. This drug is toxic to rapidly producing cells like the cancer cells. It latches onto the cancer cells and kills them. The bone marrow then receives a signal to make new blood cells. White blood cells can then mature and combat any infections the body may have, returning it to a fully functioning life machine.
Here we have a picture of Maria del Cisne in Solca getting her treatment, and in free time she tries to paint and to entertain herself. Thank you.